two meetings were
And this
everybody on
so
board.
that somehow
Welcome to the Voices in Leadership. This is a series that focuses on science and leadership to create positive change in public health. I am Betty Johnson, and I have the privilege to direct this program and to introduce today's guests. Tessa Jowell served as a Labour member of British Parliament from 1992 to 2015. She was then appointed to the House of Lords, assuming the title of Baroness, though she prefers to be called Tessa. Respected for her strong character and principles, Tessa has a true passion for public health, education, and equality. She has held numerous cabinet positions. These include Minister of State for Public Health, Minister of State for Employment, Welfare to Work, and Equal Opportunities, and Secretary of State for Culture, Media, and Sport. Tessa established the National Early Nurturing Program Sure Start, and also initiated and managed the winning bid for the London 2012 Olympics and Paralympics, and led the development of this project for 8 years. Prior to becoming a member of Parliament, Tessa's career included experience in public service as a mental health practitioner, senior manager, public service reform expert, and social policy analyst. Tessa currently serves on the advisory board of the Harvard Ministerial Leadership Program, a joint initiative of the Harvard Chan School of Public Health, the Harvard Kennedy School of Government, and the Harvard Graduate School of Education. Tessa is also a Menschel Senior Leadership Fellow here at the school. Before I turn this session over to today's interviewer, Professor Robert Blendon, Senior Associate Dean for Policy Translation and Leadership Development here at the school, please join me as we welcome Baroness Tessa Jowell to the to the Voices in Leadership series at the Harvard T.H. School of Public Health. Thank you. Thank you.
Hi, Bob London. We've agreed we're going to start a little bit differently than some of the other programs. That is, there are questions that young people are asking actually across the world, across this country, in the UK, about if I am very mission oriented and the political environment in my country changes, it goes in a direction that is not where I would go. How do I lead? How do I live my life? How do I get up in the morning sure that I can make a difference with that? And without getting into one political change here or the UK or not, this is a real issue. Those of us who've had a chance to spend time with Tessa are just struck by one of the most mission-oriented personal sense. So rather than how did I do policy in this, and we'll get into that, is really because she's had this issue. She's been a national and world leader in a world where for many of the years the government wasn't necessarily on her side. And so I just thought she would start helping people think about how she thought about getting up in the morning if the newspaper doesn't lead with the concern that you would have had.
Okay, so thank you very much, Bob. Thank you, Betty. And thank you all for having hosted me here for the last 2 months. There is always something to be done. There is always something to be changed. And there are always, we all have the resources to, together or individually, to be part of that change. So I think that's where we start. I mean, if you are a mission-led person, let alone a mission-led leader, a young person starting out, and you have this sense inside you that there are things in the world that you want to be part of changing. I mean, let me just say this. It's an uncomfortable way to be made. And there are much easier people to live with, to have as your parents and your friends and people who are mission driven. But actually, it brings a sense of satisfaction, a sense of fulfillment, and a sense of renewed challenge like nothing else I think I can describe. So it may be that young people in this country, young people in this school, and in the UK, after we voted very particularly to leave the European Union, which so many young people felt was somehow a denial of something that they'd always assumed about their country and about themselves, their identity. Because the majority, by and large, the Brexit majority, came from people who were older. But that doesn't mean that there is nothing to be done, any more than it means now in this country that you have President-elect Trump, whose values and approach may be misaligned with the values and approach of many of the liberal, outward-looking young people of this country. You know, do not for one moment think that you have to go away for 4 years or 8 years and withdraw from the possibility of change in the public world. And I've thought about this a lot I've been an elected representative for 38 years, and of those, 13 were in government and 23 were in Parliament. But if you have strong values which are connected to a sense of mission to change, then you decide really where you're going to direct that energy. And since in my early days in Parliament, when we were in opposition, my mission for change was very much directed at highlighting the conditions that particularly poor, frail, elderly people were subjected to when they tried to get into hospital. Before that, when I was leading a big national public service change programme about how is it that you improve the quality of care for very frail elderly people living in institutions, homes for elderly people, hostels for people with mental health difficulties or with learning difficulties. But how do you improve the quality of care available to them, but without spending any more money? Well, there's one way that is surefire in yielding results in doing that. You go and stay in those hostels, you go and stay in those residential homes. It's not like being 85 and confused and very frail, but you can understand a little bit about the pattern of service, about the unrealized potential that exists in those services. One of the things I discovered, I'll tell you very quickly, is I was staying overnight. It was a bitterly cold winter night in an inner city part of Birmingham where I was conducting this work. And there a couple of who have severe learning difficulties had come back to the hostel having just got married. They were having dinner, and then somebody from the hostel went home with them in order to change some light bulbs. And the head of the hostel said to me at the end of the evening, "Please don't tell them at headquarters that this is what we do, because we're not allowed to." So what you can do is to kind of unpick all the blockages to simple humanity and the very highest standards of human professional care being delivered to people who may be very silent advocates on their own behalf. So there is always a mission. I mean, next, I am a great supporter of an organisation called Help Refugees, a new startup which has been very widely acclaimed. It's winning awards for the work that it's doing with unaccompanied children in the jungle camp in Calais, and also in setting up early learning centres in some of the Greek refugee camps. I have to declare an interest in that our daughter is one of the core members of the small team that does this extraordinary work. But I hope that when I go back, having founded Sure Start, I can help them by going down to the camps in Greece, set up Sure Start spaces for children who are being denied all the kind of normal life of very early childhood.
So we need 1 minute. Sure Start. How you
Sure
got it going? Great.
How I got to get,
Yes.
for 1 minute on Sure Start.
It won't be 1 minute, but I thought
No,
we
that's
would
right.
give that and move on.
Sure Start was very much born of my own experience together with David Blunkett, who was the Education Secretary at the time, our passion about the importance of early childhood and new mothers having the confidence to be their baby's first teachers. And in a way, so much of the research about early neurophysical development has confirmed what for us was a hunch based on our own experience and on theories of attachment. So we set about designing and setting up a program which would become a national program to enable often very vulnerable mothers whose own mothers may never have told them that they were extraordinary, that they loved them, and that these were not young women who'd grown up with a sense of their own internal value, who didn't have lots of flowers and cards and presents when their babies were born, and being told as they struggled with breastfeeding that they were doing so well and that their babies were beautiful. And so the purpose of Sure Start was really to try and create a program that would reach some of the poorest children and help enrich these relationships between their mothers and these little babies. And Sure Start became a national program. It was very little understood to begin with. And I was just telling Bob earlier that I gave an interview to a research magazine a few years after Sure Start was securely established. And the chapter, my interview, was entitled "They Don't Talk About Love in Government." And the fact is that this was about building the strength of love, the bonds between mothers and their new babies, which are the prerequisite for those babies growing up to be functioning, healthy and achieving children and optimistic and competent and contributing adults. And against all I don't want you to get the idea that this is all soft-edged and all conducted in a sort of rosy glow. Mission-led leadership like this, which combines rigorous design, clarity about purpose, with this sense of internal mission, is, in my view, just about the most uncomfortable and personally demanding form of leadership. But I believe it's the best and the most effective. And I think it's also the kind of leadership that young people, and particularly those young people who feel disconnected from what has become the political mainstream, thrive in.
So one is it's just somebody studies government. That wasn't that easy to get a government to approach.
No, it wasn't easy.
The human feeling side of this just leaves me a little,
Yeah.
How am I going to get that bureaucracy to have your passion?
Yeah, and I had two patrons for this program, both of whom were very powerful in government. One was David Blunkett, who became Education Secretary, and the other Gordon Brown, the Chancellor of the Exchequer. And Gordon was a really magnificent sponsor, and David was a wonderful partner. And here's the other point: you never ever effect this change on your own. And you cannot lead this kind of far-reaching change unless people want to work with you and be part of that process. And I've got very little time for egomaniacal leadership, because it tends to be highly visible and very noisy for a short period of time and doesn't achieve that much. It's highly narcissistic and its effects then fade away. And I think, again, going back to your mission for young people, Bob, that this sense of becoming part of a movement which is clear about its purpose, and that you have internal capability, resources, determination to contribute, will mean that change does happen. And that's why we can be optimistic.
So you took this internationally, though, right? We moved from the UK to actually other countries.
Well, I hope so. It's in its very early infancy. We are, and my daughter and her team, they're at the point of raising the money, identifying the potential volunteers. There are therapists, some really extraordinary people, building on their work, working in the camps. But of course, in many of these camps, people who've left their conflict-ridden countries, mostly Syria, some Afghanistan, they're now described as refugees, but they're also teachers and nurses and early years workers and doctors, and they can contribute to this too, and just give something, and it's just something, to these children whose lives otherwise will be forever scarred by the fact that they were denied the opportunities of their very early childhood.
So what was, let's do the best and the worst of your life in government. So what was sort of the best moments? You finally are minister, will hold probably the Olympics to the end, but the best achievement, and how did you get it done? And then one when you occasionally have too many glasses of diet soda, you look back and say, wow, I wish this had gone somehow differently.
Well, yes, that's certainly true. There are plenty of those. We've got plenty of time for those, Bob. But I think probably one of my best periods in government, and we'll talk about the Olympics, because that was
we'll do that next.
That was extraordinary. But I think it was the 3 or 4 days after the election in 1997, when in the UK there was a sense of extraordinary optimism. And it was a bit like the opening ceremony of the day after the opening ceremony of the Olympic Games, but it just went on and on and on. That the country wanted a different kind of government, wanted a government that was open, wanted a government that was committed in a progressive way to equality, to creating opportunities, regenerating, time-decayed infrastructure, and had a sense of purpose to bring the country together. And so that was exciting. And going in to the Department of Health as the first ever Minister for Public Health was quite heady. And because the civil service was so excited about this, they had not been allowed in the previous 13 years of Tory government to talk about inequality or health inequalities. Well, excuse me, how do you begin to understand why, if you're on a subsistence wage, you're more likely to get sick and die earlier than anybody in this room? And so we talked, we sang, everything we did was to talk about how we were going to tackle health inequality. I immediately started focusing on where we could get the quickest gains, where preventable deaths were most prevalent. And of course, early deaths from heart disease and cancer, more likely if you were poor, and everything that went with poverty, undereducated, poor diet, probably a smoker, not exercising, all the things that mean that health inequality becomes so intractable. So I think that was very exciting. And in those early days, we started planning Sure Start. And Sure Start, if you like, preventable death was to mitigate the circumstances of people who were already on a course where they risked becoming a statistic demonstrating once again the scale of health inequality. Sure Start was basically saying we are not going to live as a country with the situation where by the time children are 3, so many of their subsequent life chances, the course of their lives, are already mapped by virtue of the experience of the first 1,000 days of their lives. And I always used to say about Sure Start, as I was reminded recently by Naomi Eisenstadt, who was the brilliant chief executive who basically made the whole thing happen. And she reminded me that I always said to her, Naomi, I always want to be able to smell the babies. And the point being that so many programs become reduced to ticking the boxes, but actually you've got to have the grit under your fingernails. You've got to be able to smell what the program likes. And going back to my residential homes, you walk into a home where elderly people are being cared for and you smell urine and you think, I would not want my mother to be cared for here. So why would you want anybody else's mother to be cared for here? Because the other great motivator of my work, I think, throughout my life has been Richard Titmuss, who was a great thinker, academic at the London School of Economics, where I am now, who always used to say, services only for the poor are poor services. Now, think about that and just apply it to every service that you're ever responsible for developing and designing. Would I use this? Would my friends use it? And if not, it's not something that you should continue to plan in the way you are. And people will always try to talk you out of it. And but remember, services only for the poor are always poor services.
So one other issue, just to get this developed further. So for the program for new ministers that we had a session one night, which I actually thought would work very poorly. We had Governor Dukakis from Massachusetts, presidential candidate, and Tessa and I thought that the differences would be too great for them to discuss. To the surprise of everybody in the audience, they both went exactly the same place, which was you can't be on the top if you don't have life experience in the programs. Both of them spent a lot of their times visiting programs, being with people. She won't tell you. Headline says in Africa, living in hut with recipients. Others are living at the ministerial mansion somewhere, reading data and statistics. So Governor Dukakis was talking about the same thing, walking around, staying in mental institutions, watching the people, watching the services, and this struck this whole audience, all of whom believed once you reach that level, you never had to worry about that. So I wanted Tessa to have one more shot about her view of leading from the top requires these human experiences.
Well, I'm used to people when I talk to them about this, and particularly how you begin to reconcile a country divided by Brexit, just as this country is divided by the most recent election. And you've actually got to start, all the best policy carries, all the best policy you can tell through stories of the people whose lives it will affect. And if you can't do that, you've got to wonder where the humanity and your own investment in the human impact is going to be. And so there are a number of sort of absolute rules about this. First of all, you have got to be out there. You have got to tolerate the discomfort, and particularly in Africa and India, where I've worked, quite a bit. Quite a bit. I have had the experience of pushing myself right to the edge of my ability to tolerate physical discomfort. I'm not a Hindi speaker, and all the children I work with there speak Hindi. The sense that I don't know the answers to the predicaments that many of these children and young people are facing. And so in developing this idea of mission-led leadership, there are no shortcuts to doing it properly in a way that delivers different kinds of policy outcomes. And data is very important, and rigor in service design is very important. But absolutely vital is the sense that you know the people who are going to be affected by this. You have had conversations with, and you've got to know the people whose needs and own lives prompt you to make the proposal for this particular policy. I carried all the years I was doing Sure Start the pictures of women in my head with their tiny babies who were struggling, and that was what inspired me. And so it's not easy, it is not soft-edged, there are no shortcuts. Don't ever stand up as the great leaders you will become and make a speech with stories that somebody else has given you to tell, because they will lack authenticity. But when you can talk about how it really is in government to your ministerial colleagues who may not quite know as well how it really is, you have a degree of authority, and you have a degree, and your proposals have a degree of integrity that makes them much, much harder to set aside.
So we have a few minutes, and there's a world audience emailing me saying, are you going to ask her about the Olympics or not? So in a few minutes, there has to be absolute lessons from not only taking it on, but trying to make it work. So the UK 5 years later says, this really has been incredibly important for this country, and we've gotten something out of it. So what are your advice for the next people here who are going to be running Olympics?
Who are going to be running Olympics,
Yeah.
or doing anything
Yes.
on that kind of scale,
Yeah.
which has that power to transform. I think I would say this, be very clear why you're doing it. Remember, to build, we talk a lot in class about team building. Build your team, and remember that success is not a zero-sum game. Remember Harry Truman, who said, it's remarkable what a small group of people can achieve together if they don't mind who gets the credit. So be absolutely clear why. We were clear we wanted to regenerate East London, transform a generation of young people through sport, and then build your team and build the solidity and solidarity of your team in pursuit of a shared vision. And you as the leader have to be the one who's prepared when necessary to go out there and take the whacks. And I'll tell you, when we were doing the Olympics, I took plenty of whacks about the media have three headlines which are programmed into their computer. One is, this whole thing is running out of control and the taxpayer's going to have to spend more. The second, the International Olympic Committee, or whoever the sponsoring body is holding crisis talks with the organisers. They see this as a doomed project. And the third is all the people leading this are completely useless and ought to be fired. So you have to be able to withstand all that, because what keeps you going are the kids you know who want to be inspired by the sporting opportunities that come, the athletes who just want the chance to compete in an Olympics at home. And something that's much more difficult to communicate is just the belief that this is going to do something extraordinary to our country.
So we have to close. One line on my part. Everybody keep in your minds, this is what a sense of mission means. This is exactly it. This is a life which puts mission as part of it, and things happen, including in environments where either the media is not very supportive or the political environment of that day. But this is someone who's done absolutely something extraordinary, but it's not always in an ideal environment. But the sense of mission just is powerful, and that's what the next generation here has to take out of this. Thank you very, very much.
Pleasure, Bob. Thank you.
If you are interested in supporting this program and others like it from the Leadership Studio at the Harvard T.H. Chan School of Public Health, please call 617-432-1318 for further information.